at McMaster University, followed by her Doctor of Optometry degree from Ashton University in Birmingham, UK. She further completed the International Optometry Bridging Program at the University of Waterloo, integrating advanced training into the Canadian healthcare system. Dr. Akhtar has a strong clinical focus in glaucoma management, myopia control, dry eye therapy, and innovative ocular aesthetics. She is passionate about utilizing advanced diagnostic technology and evidence-based treatment to protect vision, enhance comfort, and support long-term ocular wellness. इतनी exercise के बाद यही होता है. Okay. Recently, Dr. Akhtar opened her own full-scope optometry and eye wellness clinic in Brampton, Ontario. Through her practice, she is dedicated to expanding access to high-quality personalized care while empowering patients to take an active role in their eye health. Committed to lifelong learning and professional collaboration, Dr. Akhtar enjoys speaking, sharing clinical insight, and engaging with colleagues and the community advance the standard of eye care. Thank you so much.
Thank you.
बहुत शुक्रिया जनाब नुज़रत साहबा.
आपका भी बहुत
मैंने नुज़रत साहबा को जान के इसलिए दिया माइक इंट्रोडक्शन के लिए कि मैं डॉक्टरों से बहुत घबराता हूँ. घर में डॉक्टर, बाहर डॉक्टर, इधर डॉक्टर, तो यही कर लें ज़्यादा बेहतर है. चलिए मैं अब ज़्यादा टाइम वेस्ट नहीं करता हूँ और डॉक्टर ज़ारा को माइक देता हूँ. और आप यकीन कीजिए कि ये बड़ा इंफॉर्मेटिव है, ख़ास तौर से सीनियर्स के लिए, क्योंकि मैंने इनकी प्रेजेंटेशन रिव्यू की थी थोड़ी सी. और हम सब के लिए ये बहुत ज़रूरी है कि डायबिटिक के लिए किस तरह से, डायबिटिक में किस तरह से चीज़ें ख़राब होती हैं और उनको किस तरह से कंट्रोल किया जाता है, स्पेशली इन सीनियर एज. Thank you very much. Dr. Zara,
Thank you so
over
much.
to you.
Thank you so much. Assalamu alaikum. I'm Dr. Zara. Okay, so I'll get started. So आज का जो main topic है, it's protecting your vision as we age. So we'll focus on cataracts, glaucoma, diabetic retinopathy, macular degeneration, and dry eye. So to get started, why eye health matters. So of course, the longer आपकी eyesight ठीक हो, the more independent you are, driving, reading, connecting with loved ones, it's important for everything. जैसे जैसे हम age होना शुरू हो जाती है हमारी, first thing that starts is something called presbyopia. You would remember कि जब आप 40 के हुए थे, all of a sudden जो पास की चीजें हैं, they started getting blurry. It's called presbyopia, and that keeps going until 60. फिर 60 के बाद other issues also start. So we'll start with the main one that affects everybody. It's cataracts. So cataracts, and what are they? So cataracts occur when the natural lens of the eye becomes cloudy. It will affect 100% of us if we live long enough. We all get them. So I will show you. So you can see in the picture here, so ye jo right pe hai is our natural eye. So what I can do is, this works, yeah. So this right here, right behind the iris, jo hamare colored part of the eye hai, there's a lens. It's nice and clear when we're born. और जैसे हम कुछ भी देखते हैं ना, the light goes through the pupil, focuses on the lens, and then hits the back of the eye, sending the information to the brain to process the information. After 60, what starts to happen is the lens ये है, अब आप ये देख सकते हैं, it's getting cloudy. So of course, as you're looking at anything, the cataract gets in the way, blocks the light, and prevents the good image of to the back of the eye. So symptoms include blurry vision, sometimes light sensitivity, and sometimes colors can start to change. But this is one of the most treated ocular disease, I guess, in the world, and it's very, very easy to get a cataract surgery. So agar aap yahan dekhein, this on the left here is, this is how they do the surgery. So Once they have the clouding of the lens, they insert a very tiny little instrument जो अंदर जाता है, and it's an outpatient procedure. It's done in the hospital. You just do local anesthetic. You're not under general at all. तो वो क्या करते हैं? Small incision बनाते हैं. They use the ultrasound to break up the cataract, suck it out, and put a brand new clear IOL or intraocular lens in there. And उससे फिर क्या होता है? That sometimes you don't even need glasses for distance. You might need them for reading, but your vision clears up quite a bit. Usually they don't even need to do stitches. It heals on its own, and within a week you're up and ready to do whatever you were doing. Very common procedure. So, and it's the likelihood of anything going wrong is pretty minimal now. So moving on, the other thing that starts to affect patients or elderly patients is glaucoma. And इसको हम कहते हैं कि it's the silent thief of sight. So until it's end-stage glaucoma, आपको तो पता भी नहीं होता that you have glaucoma. So if you can see here, the glaucoma affects our optic nerve at the back of the eye. So on the left here is a nice and healthy nerve, and then the one on the right, if you can see, ये जो cup है, it's gotten really big, and that means that it's eating away at the tissue around that nerve. So with this, what happens is, आपका जो side vision है, it starts to get affected. And once you have glaucoma, उसका कोई treatment नहीं है, it's just management. So usually क्या होता है कि जो pressure है आपकी eye में, it is starting to damage that optic nerve. So it is important जब आप routinely जाते हैं अपनी eye doctor के पास, to have your OCT scans, your visual fields, to all the testing, because सिर्फ उसी से पता चलता है if you have early stage glaucoma. The earlier you start managing with eye drops, the better the outcome. So the problem with losing your side vision is that is one of the key factors to ensure you can keep your driver's license. Once the damage is done, the retinal tissue is gone. You don't get your side vision back. So इसलिए it's important कि अगर आपको थोड़ा सा भी there's a hint of glaucoma, your doctor will start you on pressure lowering medications to ensure that we keep your sight as long as possible. So this, for example, is late stage glaucoma. So अगर आप ये picture देख रहे हैं of the peripheral vision, the one on the right side, that's your normal driving peripheral vision. Glaucoma में क्या होता है? You start to get something like tunnel vision. So your side vision, you only have a little piece of sight left in that eye, and the side vision is gone. And with glaucoma, the management options are usually eye drops. You take once or twice a day to bring down the eye pressure. If that doesn't work, then laser or surgical intervention is usually what they need. Now, what we'll do is we'll move on to a big thing that affects, especially like Desi community, is diabetes. I had a professor in optometry school that said that if you're South Asian, you are diabetic unless proven otherwise. Because हमारी community में, because of our genetics, we are very, very prone to diabetes. And of course, हमारा जो खाना है, it doesn't help, right? Nihari, paratha, samosa, you know, our food is delicious, but not really good for our health. So how diabetes affects the eye is कि high sugar hai, it starts to damage the retinal blood vessels, and that can lead to bleeding and swelling and sometimes permanent loss of vision. So it's very, very important that at least once a year you go to your eye doctor to make sure you have your retina checked, because the two things that are affected by uncontrolled diabetes or even controlled diabetes, kidneys and eyes. And sometimes it's irreversible damage. So I'll show you here, on the right side is a normal healthy retina. There's no bleeding, there's no swelling, there's nothing. Everything is good, vision is good. On the left, you're gonna see there's diabetic retinopathy. So everything there is new little blood vessels, lots of bleeding, lots of swelling in the eye. And believe it or not, ye jo patient hai jo aayega, they will come and tell me, my vision is good, I don't think I have any problems. But when I look in the eye, there's blood all over the place. And that's because this isn't affecting the central vision yet. So you don't even know that you might have in your retina somewhere bleeds, swelling, little tears, and you may not know unless you check it. Now, why is it important to have this checked and treated? If you have little bleeds throughout your retina, it's very important because like if I had a patient who had this, we send you to someone called a retinal specialist. And what they do is they have to stop the bleeding. If we don't stop it, it progresses, gets worse, eventually leading to a retinal detachment, possibly. So wo kya karte hain? There's two things. Either they do injections in the eye, or they do laser to burn off that retina to reduce the demand for the blood vessel growth there. So not fun options, but better than losing the entire eye. But what's even better is making sure that you keep your blood sugar stable so that it never gets to that, right? I think we did that. Okay. Now the other thing I wanted to mention is after the age of about 65, the chances of something called age-related macular degeneration goes up. I don't know if aap logon ne kabhi wo suna hai. It's not as prevalent in South Asian community. It's more in the Caucasian community. Lekin it can happen. And isme kya hota hai that you tend to start to lose your central vision. With natural aging, there is a breakdown of the retinal tissue. So sabko at some point will get some early mild macular degeneration. The point is to keep healthy. So lots and lots of eating green leafy vegetables and not smoking are the two things that you can do to not get macular degeneration. So if you remember, glaucoma affects the side vision, macular degeneration affects the central vision. So all you'll see on the right is what normal vision is on the left is someone with macular degeneration. So what they see is little spots of vision missing in their central, what they're looking at. Now there are two types of macular degeneration, the dry kind, which is just deposits, and then the wet kind. The wet kind, that's the one where there's bleeding and you usually need to have injections in the eye to stop that or slow that down. Normally, agar aap jayenge apni eye doctor ke paas, and if they mention anything like macular degeneration, wo aapko ek aisa chart denge, which is called an Emsler grid, that you can monitor your vision at home. If there's any waviness, empty spots, trouble seeing faces, that's a sign that you need to call your eye doctor again. Okay, so now, this is something I'm sure a lot of people also deal with, is dry eyes. So as we start to get a little bit older, hamari jo tear production hai in our eyes, the quality of the tears gets reduced and the oils, and that's very common. And so I'll show you this here. So if you ever have symptoms of burning, feel like something is in the eye, like just a sand ya kuch dirt chala gaya ho and you're feeling that something's in the eye, wind sensitivity or even watering of the eyes are actually all signs of dry eyes. And so I wanted to actually tell you what happens. So if you look here at the top, this is underneath the eyelid. We have tubes in there that are responsible for secreting essential oils. Jaise we get older, they become blocked. So this is nice and healthy. This is starting to get short. Oops. And this is barely any glands left. Now, the longer we leave our glands blocked, the faster you're going to get to this level, jo sab khatam ho jayengi. Now, the problem with that is we are only born with a certain amount, and they have to last us our whole life. Once they're gone, they're gone. So there's a lot of treatments your eye doctor might recommend for you, including warm compresses, omega-3 supplements, even IPL treatments, or any of the RF treatments. So those are all good to prevent any blockages and to prevent any loss of the glands. So that's a little bit about that. I did want to go briefly into glasses guide as well. Though I know once you're into presbyopia, you need for distance and reading. Thoda sa confusing bhi ho jata hai of what are the different options for glasses. So, ek hota hai single vision. That will only do one task. Ya to driving, computer, or reading. The second is something called bifocals, which will be the one with the line. So at the top, two distances, distance and reading, computer and reading, or distance and computer, and that has the line. The third option is something called the progressive, which is no line and all three. And so for this, that's usually the ideal case. Lekin, Sometimes I have patients who say, we tried a progressive and I'm never gonna try it again. I hated the lens, and that's not because of the progressive, it's because when you look here, there are many different types and styles of the progressive. All progressives have distortion zones, and as you go up in quality, the distortion zones go down, easier to adapt to. So just kind of keep that in mind. Just wanted to do an overview of that. Now I wanted to share a case history with you guys. So ye ek patient tha, and he had chronic red eyes and infections. तो वो अपनी pharmacist के पास गया, फिर अपने family doctor के पास गया, and he got antibiotic eye drop, didn't work. He got another eye drop, didn't work. Then somebody gave him a steroid eye drop, thinking that that would work. It was not the eye doctor. So then eventually when his eye got worse, he ended up coming in to the clinic. And basically, this is a cold sore in the eye. So just say you can get cold sores on your lip. If you have that, you are a carrier. तो ये आपकी eye में भी हो सकता है. So my point being, to make sure if you ever have a red eye or anything like that, go see your eye doctor, because they need to put a dye in your eye called fluorescein and take a look under magnification to make sure that it's not this dendritic ulcer. Because एक जो दवाई किसी ने उसको दी थी, उसकी वजह से he got this ulcer, because it makes it worse. Perfect. And now some of the testing that is important, that I would suggest every senior get at least every 12 to 18 months in order to make sure that our vision is safe. So ek hai, it's called an OCT scan. Think of it this way, it's like an MRI for the back of the eye. So on the top is an image of the retina. That's the top of the cake. So wo top of the cake, when I look in the back of the eye doctor will see everything. Slice of the cake on its side, wo nahi nazar aayega. All the different layers, we won't be able to tell what is in there, what's going on, is there bleeding, is there glaucoma, is there macular degeneration. So I am specifically highlighting this is because sometimes your vision can be perfect, and you can come in and you look in and everything looks perfect, you run the scan and half of the retina is not there, or there's tissue that's missing. So it's really important to make sure that you routinely get these tests done for your own safety and for your own long sort of like to preserve your vision. So yeah, again, early detection saves vision. The quicker that we can detect that you have glaucoma or macular degeneration or diabetic retinopathy, the longer, the better the outcome is. Okay, then I also wanted to go over the 3 O's of the eye world, the ocular world. So there's optician, optometrist, and ophthalmologist. So this is in specific to how things work in Canada. So opticians are people that, so after high school, they do 1 or 2 years of a diploma, and they're allowed to sell glasses. Optometrists are, which is what I am, is they do 4 years of undergrad and 4 years of optometry school, and then they write board exams. And they are the primary eye care provider in Ontario and all of Canada. Then you have ophthalmologists, which are, they go to medical school for 4 years, and then they do a residency for 5 to 7 years. And specifically here, you need a referral to see an ophthalmologist. And because of the burden on the ophthalmologist, oftentimes they reject referrals from family doctors, and they suggest they go you see your optometrist first. So in order to get to the surgeon for your glaucoma or for your cataracts, the best path is to go through your eye doctor or the optometrist. Now, I always tell my senior patients that just like you have one family doctor, you should have one dentist and you should have one optometrist once you get older. Because agar aap different jagah pe jayenge, it's like starting from scratch. If you go see someone 1 year and someone else the second year, we don't know if your pressure was 12 1 year and 19 the second year. Both are within normal range, but 19 is not normal for your eye. But if you had gone to the same doctor, they would have seen that jump and said, hey, no, something's not right. We need to investigate what's going on. So for continuity of care, make sure you go and you stick to that one doctor, one dentist, one optometrist that you trust and that you like, because I've seen way too many things fall through the crack. Advanced glaucoma miss ho jata hai, advanced macular degeneration miss ho jati hai, simply because people have been going to different locations, different places, right? And if you ever do switch your eye doctor or your dentist, you can always ask to have your records transferred. So it's always important to do that. The other thing I was going to say is for senior patients is make sure when you choose your optometrist, it is one that is not an optical. You can go to an optical store, but they usually do not have the advanced testing that you need. So there are plenty in Milton that have full scope optometry where they have all the testing they can do and manage everything in-house. So, and generally your files are safe with the doctor there. Even if you see a different doctor at the practice, your files are there. In an optical situation, agar aap jaise same optical ja rahe hain, aapki files are not the property of the optician, they are the property of the eye doctor. So aapki files are gone with the eye doctor. So if they start to work somewhere else, they're gone. Just so that everybody knows that that's how that works. Now, in terms of OHIP coverage for seniors, every senior from 65 onwards is covered every 12 to 18 months for a routine eye exam. So and your doctor will tell you whether you need to come in 12 months or 18 months. They know what they need to see regularly. So make sure you go, pre-book your next appointment so it's in the calendar. Now, in addition to that, seniors also have 2 other appointments that they can go to specifically to their optometrist for. So you do your one full eye exam every 12 to 18 months, but uske baad, if you have an eye infection, flashing lights, floaters, eye pain, anything, you can go twice in that 12 to 18 month period and OHIP will pay for that. So just keep that in mind. So if you ever have anything, you don't have to go to your family doctor, you don't have to go to the pharmacist, you can call your eye doctor and they will take you in, prescribe you the medication that you need. And then these are some of the things I just wanted to go over. That's very important. If you ever experience any of these, this is an urgent situation. So either you see your eye doctor within 24 hours or you go to the ER. And the main things are flashing lights in your vision, any changes in your floaters. So wo jo black dots hote hain, when you look at it and it moves, if you have a couple, no problem. If it goes from 5 or 6 to 30, that's a big problem. Red flag, so you need to call your eye doctor or go to the ER right away. Sudden double vision, shadows, curtains, any of these things, you do need to make sure that you go see your eye doctor. And yeah, so this is, I promise, this is now the end, the last slide. Basically, action steps. In order to make sure that you are doing the best for your eye health is 1, your routine eye exams, wearing UV protection sunglasses, don't smoke, and wearing the right glasses that fit your lifestyle, and then seeing your eye doctor for any issues that you have. That's it. Thank you. My clinic is called Peel Eye Care in Brampton. It's located on 499 Ray Lawson Boulevard, Unit 13. Main intersection is Ray Lawson and McLaughlin. And phone number is 905-487-4511.